Hi everyone, my name is Dr. Joseph Hammer and I'm an assistant professor of counseling psychology here at the University of Kentucky in the College of Ed. And today I wanted to talk about masculinity and how it's played out in my life as a personal and professional. When I was an undergraduate student and I knew that I wanted to go for my PhD in counseling psych, and so I started to learn more about the various areas in which someone can do research in psychology. I stumbled across Division 51, Psychology of Men and Masculinity, and their journal, and was really fascinated to learn that we in this profession actually study empirically and intentionally how these socialized expectations that we have of men and that men have of themselves influence how they think, feel, behave, their health, how they treat other people, etc. And I was just fascinated by that because this is something anecdotally that I had thought about for a long time growing up, just thinking about the messages I was receiving about how I was supposed to present to the world and what I was supposed to be about and value, and wrestling with these questions of how to strike a fine line so that I could feel like myself and do things that felt right and comfortable and moral and not get rejected by the peers around me, who were ready to put me back inside the gender box if I strayed too far from what was expected from me as a boy and then a man. And so I think about a few salient pieces of my masculinity and my performance of masculinity as it relates to this work that we do in counseling psych. And by far one of the biggest pieces is how I have been taught as a guy to manage and interact with my emotions and the emotions of other people. So if you grew up in the United States where dominant Western traditional masculine norms about emotional stoicism or keeping it stoic, keeping it even-tempered, calm, not showing vulnerable emotion in particular, that there's this dominant cultural prescription out there. And it definitely impacts white men, and to some extent it filters into other cultural groups as men, although each racial ethnic group also has their own cultural twist on what's expected around how to deal with emotion and how to express it. But for me, as a white guy, I was always taught that I need to be tough, I need to be unreadable in certain situations, and I don't want to show vulnerability, except in maybe rare circumstances, maybe possibly with a romantic partner, but definitely not with friends, definitely not with strangers. Basically, if you've looked at Brene Brown's videos about vulnerability, she talks really intelligently about it. It's really illuminating, I think. And so for me, I got really good through being trained by my peers and my cultural system and my teachers and my father and my family members to be stoic. So that is and will for the rest of my life continue to be my default, is kind of in this place of emotional calm and stoicism and detachment in a way. And I have seen situations where that's been really beneficial or adaptive for me, and then there have been some situations where it's really gotten me into trouble, really has limited my life. And I could do a whole video series on just this piece of masculinity and emotion, but I want to keep this initial foray brief. So one way in which it shows up is that in the therapy room, when I was learning to do therapy for the first time, and I had therapists who were integrated therapists. They drew upon several approaches, and as a part of that, emphasized the importance of attending to clients' emotions, their affect, and really honoring that and using that as a key guidepost in the work. It was harder for me to do what are called micro skills, or the core counseling skills, or active listening skills of reflection of feeling. Oh, it sounds like that made you really sad. That's a reflection of feeling. Or open questions about feeling. How did you feel when she said that to you? That would be an open question about feeling. So emotion-focused interventions like that, not only asking or reflecting on that initial emotion, but once the client has said, like, yeah, it made me feel really sad, then for me as a therapist, is like, my therapist is saying to me I'm supposed to stay with this feeling and deepen this feeling, but I don't know what that, I hear that, but I don't really know what that means. I don't know how to do that. And so my growth edge, and honestly it continues to be a clinical growth edge of mine and will for the rest of my life, even though I'm 10 or so years into doing therapy and much better at this growth edge than I was. But because this is this masculine stoicism is such a strong part of how I've been socialized and now see the world and experience the world, I won't ever be able to get rid of this piece of myself. But what my supervisors, like Dr. Mei-Fen Wei, when I was at Iowa State doing my PhD, she really helped me think about this becoming more emotionally intelligent and attuned with client as not being someone different than myself, not straying from myself or trying to be someone I'm not, but being more flexible with who I am, which I really appreciated that reframe, because I can't change who I am and that stoic default, but I can, with intentional practice, with intentional choice and awareness, choose to be more emotion focused in my work with clients. So that has been a big growth edge for me, and one I've really struggled with, especially earlier on in my training, is learning how to do that, because when I would try and use those interventions or deepen, there'd be the socialized part of me that was like, this is really uncomfortable, it's unnatural, I don't know what to do, it feels wrong or icky, it feels like I'm violating some rule or norm I'm supposed to do, which just went to show how deeply socialized that norm is in me and how much it made my work difficult. One of my motivations for sharing this as a part of my Culture, Diversity, and Social Justice series is that I think that this struggle I had and this growth edge I continue to have is one that's shared probably by some of you. Whether you're a guy or a woman, I've seen folks across the gender spectrum who this can be something that's one of their growth edges because of how they were socialized, how they were taught by their surroundings to work with their emotions. And so I hope this can normalize that journey if it hasn't been normalized for you already. And I hope to, in future videos, go into more depth. But to kind of wrap up and conclude, a big piece of my own cultural identity around my gender identity and how I present is around this traditional masculine socialization, specific to this norm of emotional stoicism and being tough and not showing vulnerability or staying in that place very long, and how that personal stuff impacts my professional counseling psychologist self, how it shows up in the room with clients and has made it more difficult to give them what they need in terms of that good emotion focus, because we know from the common factors research that an emotionally charged relationship and experience tends to enhance clinical benefits for clients. So it is worthwhile to learn how to do that. So yeah, just some reflections on my own masculine socialization, and I will talk to you next time. Thanks.